and Jeff, maybe you could entertain a couple of questions. We don't have a lot of time, but maybe 2 questions. I don't know where to get on. Are there any questions?
Do you think that we can succeed and proceed within the context of capitalism in that?
No. Okay, you have 2 minutes.
The answer is no.
Okay, the question was, do the speakers think that we can proceed within the context of capitalism?
I think I echo Fiona. Absolutely not. I mean, it's not that structure is not set up for caring about individuals. She just said that we should be saying that more. That's maybe the larger context in terms of how we frame out these systems that just are broken, right? And I mean, I think there has been a lot of critique on kind of neoconservatism, neoliberal structures of capitalism per se. I think in this context, it's about how do we change pieces that will at least allow a more adequate standard of living so people can survive better.
Because I think that I think that we can have the kind of overarching examination of the whole capitalist system, but at the end of the day, if we are trying to respond to the immediate needs of people, right? Then what do we do? We need to have a government that has the will to respond to the immediate needs of people who need support. And I think that there's a little bit of a tension there between the higher level philosophical ideas and the immediate needs of people on a day-to-day basis.
And we should also be returning to this discussion around social democracy, right, as a key piece. And the guaranteed annual income, it can be very much aligned with the social democracy. And I think that is more realistic in this context.
One more question, and then of course we do have another opportunity for questions at the end, and both speakers will be there for that.
Hi, thanks for that information. That was great. I guess the question would be, I see the government as the representatives of Nova Scotians, and they seem to be throwing up a lot of barriers to these programs and people accessing these programs. So there are people that don't want these programs to be accessed and be used by people. And I'm just wondering the reasons behind that. Have you guys encountered people justifying reasons such as laziness, or like people just not don't have the right to access those kind of free programs?
Right. Well, I think that in my experience, it's been that the current system, and I would say that it's a long-standing system, that it does automatically assume that me as a recipient or applicant is going to be trying to get something over on the system. There seems to be a real kind of focus on that, and that would take a huge cultural shift, right? And it would take really focused and strong political will to change that, right? And to make sure that people aren't automatically assumed guilty. I mean, we don't have, in the criminal justice system, people have to, there's the assumption of innocence, presumption of innocence, right? But when you're on income assistance, you're presumed guilty and undeserving right from the beginning. And so
it's an adversarial culture.
Yeah.
It's embedded in like the framework. So
Yeah.
you have to fight for everything. And you know, with a system that's broken, one of the latent functions is that now we have a whole community of non-government organizations that's really trying to pick up the pieces. And they are completely overwhelmed, strained, underfunded, primarily from the system that is also underfunding and undersupporting this population. So you have everything's a fight. It is consistently this adversarial system that any special, like I think Fiona highlighted so eloquently, like special needs now, which was something that was provided earlier as a kind of basket of support, you have to fight for everything. And even we've noticed at the clinic is that even after appeals, we don't even understand why maybe sometimes partial remuneration emerges. So you don't get the full basket again, you get just partial, there's no explanation. You have to reappeal again to kind of explore why they're not treating people as human beings that need that support.
And it's hard to know what goes on, right, in the training of the Department of Community Services. And I don't want to vilify the actual workers who are on the front lines, right? Because they're the people who are are the ones who have to deal with people's unhappiness, and they have to deal with me when I call them up, and other advocates, right? And but I don't know what the training is and how they get trained, but it certainly appears that the training does focus on, don't let this happen, put this roadblock here, and let's see where the chips fall.
Patricia Williams, who will be introduced by Sarah Martin. And Sarah.
So, Patricia Williams is a professor and Tier 2 Canada Research Chair in Food Security and Policy Change in the Department of Applied Human Nutrition at Mount St. Vincent University. She is the founding director of FoodArc, the Food Action Research Centre, which received the prestigious Canadian Institutes of Health Research, CIHR, Partnership Award in 2011. Her research focuses on the use of participatory action research to engage intersectoral partners, including women experiencing food insecurity, in building capacity and moving knowledge to action, with the ultimate aim of creating the conditions for food security through social and systems change. She has led several national and provincial studies on food security-related policy change, including 7 cycles of the participatory food costing in Nova Scotia from 2002 to 2015, a 5-year, $1 million Social Sciences and Humanities Research Council-funded Community University Research Alliance, Activating Change Together through Community Food Security, from 2010 and 2015, and a comprehensive assessment of the consumer food environment in Nova Scotia, which is currently underway. Her team's collaborative research has culminated in innovative knowledge-sharing tools, including Making Food Matter, Strategies for Activating Change Together, the most comprehensive report on CFS in Nova Scotia to date. Thought About Food, a workbook on food security and policy change, a board game called The Hand You Are Dealt, and an online toolkit called Make Food Matter. She is a founding member of the Nova Scotia Food Security Network and the Nova Scotia Food Policy Council, and an associate research scholar, Healthy Populations Institute, previously AHPRC at Dalhousie University. She teaches in the Applied Human Nutrition Graduate Program at Mount St. Vincent University. It's my pleasure to welcome Patricia Williams in her talk entitled Food Security in Nova Scotia, Shifting the Conversation Beyond Band-Aids.
To be here and be part of this conversation. I was so excited when I was listening to the news and I heard the announcement from Ontario. They were going to be doing a pilot project. And then when I heard Art Angleton on Maritime Noon several weeks ago, and And then knowing that this was happening as well, and when Mandy asked me to be part of today, I kind of, I didn't say yes at first. I went back and said, well, what do you want me to talk about? Because food and, a basic income guarantee, it's critical. So it was, she came back and said what the goals were in terms of bringing people together to start a conversation, to explore ideas and where there might be controversy. And that's what our work at Food Arc is all about, to explore ideas that maybe are, as Wayne said, complicated or complex, and to figure out ways that we can really understand those issues, what the root causes are for those issues, and do something about them. So what I'm going to talk about is just going to give you a sense. I'm going to do exactly what Mandy said. I'm going to talk about what food security is, or food insecurity. And I'm going to talk about why that's such a critical part of the conversation around a basic income guarantee, and how food security can actually be used to make the case and really build a strong case around the need for a basic income guarantee or an adequate livable income, or part of that conversation. And then I'm going to talk about some of the work that we've been doing at Food Arc to help to contribute to that shift. So, I guess I really like the kind of the juxtaposition of these two statements, in that, one is kind of at that level of sort of a national, this statement from the philosopher Brilliant Savarin, who talked about, he's a gastronomer, and talked about the destiny of nations depends on the manner in which they feed themselves. And so I'll show you some statistics around what that looks like in Nova Scotia in a minute. And it's dismal in Canada right now. Our rates of food insecurity have been increasing, and we're not doing a very good job of feeding ourselves in many ways, especially those who are living in poverty in Canada and here in Nova Scotia. And then this quote, the bottom quote, is from a participant of a research project that we did. Hearing stories of people living with food insecurity, and she said it's a given that you should have food. It's a basic staple in life. Everybody should have it. If you don't have it, you're somehow a failure. And it is. It's especially if you're a mother. Food is part of nurturing your family. And if you, as a caregiver, whether you're a mother or a father or a caregiver, you really worrying about having food or not having food, adequate food to feed your family is huge and has far-reaching impacts that I'll tell you about. So, what is it? So, it's the inability to obtain sufficient, nutritious, personally acceptable, and I would add culturally acceptable food through normal channels, or the uncertainty. So if you're worrying about doing that, then that is part of how we define food insecurity in Canada. And in the Food and Agriculture Organization, the United Nations defines it as lacking physical and economic access to safe and sufficient and nutritious food to lead an active and healthy life. And in Canada, the way that we measure it right now is really about economic access. We don't measure the physical access to food. So I'm going to show you some statistics that kind of get at that, but it's really about not having enough money to afford food or worrying about not having enough money. And to the degree of going without food in Canada, which is should be unacceptable in a country like this. And I was glad that Rob brought this up earlier, so I don't have to really go into this, but going back to kind of those physiological needs, those basic needs for food, water, and etc. And there's sort of that basic need level. So food insecurity is a deprivation. It's a material deprivation of basic needs, and it's also not just that sort of basic need. It's that also level of psychosocial impact that it has. So it not only is it deprivation in terms of material aspects, but it's also, it leads to deprivation in terms of the other aspects of Maslow's hierarchy here, and really gets at sort of the ability to have healthy communities and communities that are vital and vibrant, and that enjoy kind of well-being and that feeling of looking after one another. It was all about this sort of that top level of Maslow's hierarchy here in terms of feeling that way and that pride in yourself and in your community and being able to participate and being able to contribute. And so not having that material adequate food really has an impact on the ability, the psychosocial part of it, and our ability to contribute to our communities, as we've heard about. So we've heard some statistics about food insecurity in Canada so far, and we've heard that Nova Scotia has the highest rate of food insecurity. That's of all provinces. If you look on the map here, you can see that the north is quite a bit worse off than we are. And actually, there's new data out just last week or so from Valerie Trask's Proof Research Group, and it shows that the rates of food insecurity have gone up overall. In the north, it's approaching very close to 50% now in Nunavut, and higher in Northwest Territory as well. And in Nova Scotia, it's actually decreased a little bit. This latest report, which is from the Canadian Community Health Survey 2014, that's just come out. So the survey from 2013 shows that Nova Scotia was at just almost 1 in 5 Nova Scotians, 18.5%. But we've seen a decrease. And so Halifax is no longer number 1, the highest rate of food insecurity in the country. We're number 2. Peterborough is now higher than us, which is also, sad that we are still there with about 1 in 5 people experiencing income-related food insecurity, where they're either worrying about running out of food or they're having to themselves or their child go without food for 1 day or more within their household. And if you look further at some of these rates across the country, and the other thing to point out here is I'm doing work with Food Secure Canada looking at the situation in the north around the price of food. But we know that Indigenous communities across the country experience far higher rates of food insecurity than they're one of the populations that are most vulnerable. People that are Black, women who are on their own raising children have higher rates of food insecurity, people that rent their own homes, new immigrants. So there are pockets of people that are more vulnerable, and so these are just kind of the people that fill out that complete, I should say, the Canadian Community Health Survey. If you look, Valerie Trask's group has looked at determinants of food insecurity, and what we know is that income is the biggest predictor of food insecurity. And you can see there, this is household food insecurity, the prevalence of households on your the y-axis, and then on the x-axis is the annual income that's adjusted for household size. So you can look at that, and you can see that it is, if you are at the lower level of income, below the low income measure or low, whatever sort of measure of poverty that you're looking at, you can see the rates are very high, approaching 50%, experiencing food insecurity, and then as income increases, it goes down. And because there's not enough people who experience food insecurity at the upper income levels, there's not enough data to really look at that. And then this is another way of looking at it. This graph actually shows severe food insecurity and moderate food insecurity. So severe is when you go without food or your child goes without food. And so it's fairly significant. 15% of those that are, in terms of the household income ratio to the low income measure, it's, in terms of the people that would be at that moderate and severe level, it's significant. And this is, it provides sort of more, I guess, evidence to suggest that it is really the role of a guaranteed annual income that or guaranteed adequate income, that when we look at the people who are at risk of food insecurity, if you're on income assistance in Canada, it's about 62% of people. 62% of people on income assistance experience food insecurity. In Nova Scotia, it's actually this latest report that just came out. About 85% of people on income assistance experience food insecurity in the province. But when you look at the total people experiencing food insecurity, 61% of them are wage earners. So, in looking at the total numbers, it really suggests there is a problem with low wages, but there's also a huge problem if you happen to be on the system, on income assistance or disability support. And you can see there that, among seniors, it's still at 12.1% of people that are food insecure would be earning or getting seniors' income. We've seen a huge, this is one area where we've seen a huge decrease in food insecurity. And you do see a shift, as Wayne alluded to this morning, in terms of his impending birthday and turning 65. You do see it actually, the people experiencing food insecurity once you turn 65 is cut in half. So there is a protective factor of that guaranteed income supplement at age 65 that really provides evidence that a guaranteed basic income can really go a long ways in terms of decreasing food insecurity that we're experiencing. So we've been doing some work with many partners across the province and across Canada to look at really to produce evidence on the problem of food insecurity in the province, and really to look at, can people on low incomes, income assistance, public pensions, and minimum wage, can they afford to eat a healthy diet? Because a lot of people say, people just don't spend their money right. People don't have a budget. They're just going to spend their money on the wrong things. And so that was part of the reason we wanted to, when we started to do this in 2000s, when we started to try to do this. And we decided, the Nova Scotia Food Security Network had done some prior work in the late 80s to try to look at this, look at the cost of a basic nutritious food basket compared to what people would get on welfare at the time. And they were successful in advocating the Minister of Community Services at the time to increase social assistance rates in the province. But it didn't have a lasting effect. Once the cost of living raised, people were in the same boat, and it just wasn't enough to really make a difference. And so when we started to do this, we started to talk about it in 2000, we decided that we wanted to use a different approach to look at this and to produce the evidence and to ask these questions. And so we decided to, part of the call for doing this was to have a workshop here, and resource centers were and so we approached them and called them. Sorry, it's kind of hard. I know I'm also competing with your breaks, so I'm trying to speed along here. So just to say that we partnered with family resource centers in the province to engage people. They work closely with especially women who experience income-related food insecurity and other challenges. And so that was, we wanted to engage people with experience of the issue to learn more from the perspective of the reality of living in that situation. So, and we also wanted to do this in a way that was going to be more sustainable, knowing that it wasn't going to be a short-term kind of fix, that it was going to be, we were going to have to sort of work at it long-term and try to work with others collaboratively to try to create change and sort of the drip that creates the crack in the rock eventually, which I think we're maybe getting to here. So these were some of the other goals of this project. I'm going to just present specifically on some of the data that we've produced. So we each year, it started out every year that we were doing this. Then it went to every 2 years, and now we're at every 3 years. It's been funded through the Department of Health and Wellness. So the provincial government funds this research where we look at the cost and the affordability of a basic nutritious diet in the province for different groups that would be vulnerable and living in low-income circumstances. And essentially what it's proven for many people that it's not as a result of poor choices or lack of budgeting, that simply at the end of the day, if you do the math in terms of what people are earning and what they would be spending out in terms of meeting their basic essential needs, that you can't make ends meet. So this is just one example of the scenarios that we produce with our partners, looking at what people would be getting in terms of monthly income, and then subtracting off what their expenses for their basic, what we consider to be basic essential needs, and then factoring in the cost of a food basket, which we measure across grocery stores in the province, or a random sample of grocery stores. In this case, this is the last time that we did this, that we released a report was June 2000. Well, we released it in 2013, but the data is from 2012. This is a lone mother earning minimum wage with 3 children. And so you can see her minimum wage earnings, what they would be, the child tax benefit, the working income tax benefit, GST, HST divided over 12 months, and then the Nova Scotia Affordable Living Tax Credit. So those would be all her potential sources of income. And then looking at, so we use primarily the survey of household spending, but we also tap into sort of what would be the best data source to come up with a conservative estimate for things like shelter, power, telephone, transportation, childcare, clothing, footwear, personal care expenses, and then household cleaning supplies. And we use the survey of household spending, the second decile, so it's a very conservative estimate from the survey of household spending. And then we, like I say, measure the cost. We partner with family resource centers and people, women primarily, who have experience with food insecurity, go out into grocery stores across the province, collect data, bring it, share it with Food Arc, and we work with them to look at the data, analyze the data, and then look at the data and try to interpret it and produce these reports. So in 2012, when we looked at the cost of the food basket for this family scenario, the lone mother with 3 children, the cost was $776 a month. And so when you do the math there, you can see that this, and this is just an assumption that this family would purchase the basic nutritious diet. If they were to do that, it would be, essentially impossible. And so what happens there? I mean, so this just seems like kind of crazy, $800 in the red. So we know that the food is the most flexible part of the budget, and so nutrition is what gets compromised. So people are going to pay their rent, they're going to pay their power bill, or they're going to pay part of their power bill. And, so it's the food is the flexible budget here, and what gets compromised. And we hear it over and over. Research that students of mine have done have shown that, people living in situations like this, eat a very monotonous diet. It's sort of, the typical dinner, it's not, and we know that people living with food insecurity don't get enough fruits and vegetables. Milk intake is compromised, and often meats tend to eat a lot of processed meats. And so diet is, people skip when it comes to diet, and it has huge impacts. So this, considering, we look at several minimum wage scenarios, and what we've done is look over, because we've done food costing in the province over a 10-year period now, essentially, what we've been able to do is sort of track that and sort of standardize our methods over time. So using standardized methods and kind of looking across time at what people were getting in terms of minimum wage. In this case, this is a family of 4 with one parent working full-time and one parent working part-time with 2 children. When we first did the research in 2002, when when minimum wage was $5.80 an hour, that family would have been experiencing a deficit of $250 if they were to purchase that basic nutritious diet. Because we've seen quite a significant increase, 79% over this period of time, increase in the minimum wage, it's actually, you've gone a long ways in terms of, improving this family's situation. They still, in 2012, were facing a deficit of about $50 a month if they were to purchase that basic nutritious diet. And that's assuming there's no emergency expenses, dental, new glasses for any of the kids, or, any family member, no emergencies. That's assuming just basic needs. They would be, they'd still be struggling. We've just redone our collected new food costing data in 2015, and we're in the middle of analyzing our data and updating our affordability scenarios. And essentially, what we're seeing for minimum wage is that there's, again, because we've seen an increase, we're at $10.60 an hour, and it's minimum wage just went up again. We are seeing that there's a slight increase, but it's not anywhere near enough to make a difference for families. For this family scenario, or for some of the other family scenarios that we've looked at, like the lone mother with 3 children. The only household that we've looked at that is kind of meeting their needs with a little bit of extra, like $40 above the red line, is a male that would be working full-time, so full-time 40 hours a week. And we know our talk this morning in terms of precarious employment, how difficult that is right now. So this is just, I'll just go through this quickly. A family of 4 on income assistance, a boy age 13 and a girl 7, and again 2012 data, and you can see a significant deficit if that family were to purchase a nutritious diet. And again, with our new data, it's even worse. It's about $1,000 in the red if this family were to purchase a nutritious diet. So it's way worse because the cost of living is going up. And like we heard over, the increases to income assistance have been stagnant over the last. We've seen some increases in the province, but not nearly enough. And the last 3 years, we haven't seen increases. And then we've also mapped, this is a paper that we published in Canadian Journal of Public Health, and we mapped the deficit that, again, standardized the methods and mapped the deficit that families would be facing. And you can see the trend there for families dependent on income assistance, in this case, the family of 4, in 2000, I guess I'm missing the top. The dates, 2002, they would be facing, they were facing a deficit of about $120 or so, and you can see that how much that's increased over that period of time. So it's a dismal picture. It reflects the levels of household food insecurity that we're seeing in the province from the Canadian Community Health Survey. So our policies in Nova Scotia, even though we have seen increases to income assistance and minimum wage, it's not going far enough in terms of addressing the problem. So I think this is where it points to when we published our paper in 2012 on the issue with income assistance. We made a call there because we need to shift the conversation to an adequate livable income. And when we looked at the data on minimum wage, even though there had been a 79% over that period of time in minimum wage, it's not near enough for people to be able to afford to live. I mean, barely meeting their basic needs, let alone kind of thinking about social inclusion, thinking about their education, being able to take their children on a vacation, or have a birthday party or that type of thing. So there's a huge problem, which we've heard a lot about. And so the experience of food insecurity is something else. So these are numbers, and they paint a certain picture. But when we've gone across the province several times, and we've held story sharing workshops where we've collected qualitative data. We went across the province and talked to women about their experience in trying to access milk for their families, if they were families that drank milk, that liked milk, but we found that they weren't getting enough milk. Some work that I did with Dr. Lynn McIntyre. And the findings are the same, and it mirrors the findings across Canada, where the experience of food insecurity is essentially that it's a huge struggle. People are they're faced with impossible choices of, not buying medication to be able to afford their basic needs, cutting back on their food budget, they're maybe, watering down their beverages, including milk, they're, borrowing, they're stealing, they're buying food on credit and not being able to sort of pay the debt. There's all kinds of coping strategies that people use. They rely on charity, whether that be through food bank or through their family, but we know how much stigma is attached to that. So people feel judged from all angles, whether that be through their having to go to a food bank. Only less than 1 1/4 people will go to a food bank because of the stigma and things that are attached to that. Some people, will go to family members, but even that's very difficult, as you can imagine. So sort of the coping, the stress that's involved in coping with this, we heard, so many women talk about kind of the impact it had on themselves, their own health, their mental health, but also the impact it had on their ability to parent. And the impact that they felt it was having on their children, even though they tried to protect their children, tried to hide from their children were impacted. And there's starting to be more and more research produced to show, even though nutrient deficiencies aren't showing up in children that live in food insecure households because parents protect them, the other impacts are there. We're seeing that there's increased, I'm getting ahead of myself in terms of the impacts, but we're seeing that there's huge encouraging impacts on children, as well as in our case we studied women, we didn't talk to men, so we're not sure about the impact on sort of men in the household. And the lack of support within the governing systems was a huge theme that came across all of the data that we've looked at, and consistent again with other research. So that's within, mainly people talk about income assistance, where there was, just not that lack of support in terms of being able to advocate for special needs that they might be eligible for, or being turned down, the surveillance that they undergo, all kinds of judgment and lack of support that existed there. Just a couple of quotes. That just gets at what I was talking about earlier around the only thing that people have control over is the food budget that they can, that they can cut essentially. And then, we hear about, and somebody was just telling me about the World Health report that just came out that says that we need to be, we need to eat a healthy diet and we need to be physically active, and I hear that all of the time. But when you're on low income, what does that mean? And in terms of this mother, it meant that, she's glad that her child's learning about nutrition and his food guide, but it's a huge stress for people to be able to follow that and know what they should be doing, but not be able to do that for their children. And this is one of the most powerful quotes that we've heard, and we use it a lot when we present because it really makes the point of a lot of these themes that kind of come up in our qualitative research, where this particular mother, would have university training. She ended up, on her own in a situation that she had not expected herself to be in, and the impact it has in terms of mental health, self-judgment, and just it gives you a sense of, she never thought she would be in such a predicament. And again, like I said, we've done this research in relation to milk, and I just wanted to sort of, it has huge meaning because milk is something it's just, in Canada anyway, it's something we consider to be a basic, highly nutritious food, but it is a huge challenge. And the main barrier that we've heard about is the cost of milk, basic inadequate income. No surprise. And oftentimes people ran out of milk for 10 days or more, and that just in itself for mothers who have children knowing that they need milk for their development is a huge stress. And so there's just to give you a sense, there's a lot more. We've published several papers out of this milk insecurity research, but it really mirrors the experience of food insecurity, but it's almost that milk is seen as an elite item that people don't have access to if you're living in poverty. So the impacts of food insecurity, like poverty, are far-reaching, but what the evidence has shown, and there's reams and reams of evidence around the impact on physical health, on mental health, and more evidence that's starting to be produced around the impacts around social health, social exclusion, isolation that happens, people feeling alienated within their communities, powerlessness, and there's examples. I remember talking to a family resource center partner who worked with a woman, and she was living in a very food insecure household that was low income, but also related to I guess violence within her household, where her ability to get food was attached to control that her husband had over that food budget, and so it's not always sort of straightforward. There's other things happening. So it points to the need to sort of be thinking about things more broadly in terms of a comprehensive approach and the other supports that families need as well. And in terms of children, the mental health impacts, there's some really good research lately to show that the impact of the experience of food insecurity really, it's even a relationship to suicidal ideation that within adults, and that they're seeing some of that in teens as well with the experience of food insecurity. A really great study was published just in 2015 that shows that for people living with severe food insecurity, remember it was 15% among those in sort of the lower income group, that healthcare costs are actually 76% higher among that group compared to groups in food insecure households. And then for children, I've talked about that, I'm not going to go into that anymore, but it's not only there's the impact of modeling, of healthy eating that's happening, that, we know that the risk of chronic disease is increased in food insecure households, the ability to manage chronic disease, and the modeling that parents are able to do around healthy eating and healthy behaviors is impacted, and the ability for people to be, healthy in terms of future generations in our communities. We know that it is, this special issue of the Canadian Journal of Public Health was published in 2005, so it's old, but at that time it stated that inadequate income was the most significant determinant of healthy eating in Canada. And since that time we've seen increasing rates of food insecurity. So obviously there's something, we need to do something different if we want to have an impact on this, and that's why I'm really glad that we're talking about guaranteed annual income and moving towards, how do we ensure adequate livable incomes for everyone. We, again, we have clearly articulated policy directives for food security, in our Canada's Action Plan for Food Security, and the Special Rapporteur on the right to food. I just visited Canada in 2012, and pointed out that we're really not doing a very good job in Canada in terms of standing up to our commitment to the right to food. So there's a problem there, particularly with our Indigenous populations. And so now's the time to start to talk about what we need to do differently. But unfortunately, the primary response is still to think, okay, we have our food banks. And we're seeing, this just shows the number of people using food banks. Remember I said earlier, only 1 in 4 people will actually be experiencing food insecurity will actually go to a food bank. So it isn't the answer. We can see that there has been, an increase in the number of people overall kind of accessing food banks. So definitely the demand is there, but we've done some research with Dr. Valerie Trasik on the charitable food assistance in Halifax, and there's lots of, it's volunteer driven, it takes a lot of energy and resources. We see the numbers of food banks increasing, but it's a Band-Aid for the situation. We know that our food systems are in crises as well, and so it's not just about minimum wage income assistance. Our farmers are struggling as well, and if you look there, you can see that the actual total receipts, but by the time that farmers sort of at the end of the day, what they're left with, the total net income is quite a bit lower than that, and so they're very, very powerless within kind of the food system. So there's that side of it that, I think the income project showed that maybe there's some potential for guaranteed annual income to have a positive impact in terms of farmers' ability to farm and take risks and that sort of thing. So some of the things that we've been doing at Food Arc to shift that conversation is there's lots of tools that we produce. The food costing modeling tools is one, but we have a workbook on food security and influencing policy, some DVDs. We released a report on community food security in the province that called for a shift in how to make food matter, and so how to achieve healthy, just, and sustainable food systems, and identify adequate livable incomes as an area. It's one of 5 areas that are ripe for action. And partly because we were starting to see a shift across the country with groups like the Basic Income Network and so on, and things happening towards that. So we really felt that was ripe for action, and so glad to see this happening. So the report is available on our website. The other point I just want to make in terms of, what's been, from our experience, what's been really successful over the last 15 years is working with community partners. So, as an academic, really strengthening my research by partnering with communities to really direct that research and to guide it, inform and move it to action. So working collaboratively with government and with community partners to really tackle some issues where there might not be agreement, but people can come together around meaningful processes that can help them have meaningful conversation to identify solutions and to really be able to tap into, Wayne's part of our advisory committee for our food costing report that we're about to release, and has been hugely valuable in informing. We're doing scenarios that look at disability supports, and so having Wayne's voice as part of that table has been really important, and similarly with the women that have been involved in the research. So I'm going to leave there's a game. We've been trying to kind of also come up with creative approaches for shifting the conversation around poverty and getting at how do you, for people that have maybe different ideology, different ways of thinking about this, how do you shift, how do you get them to understand, kind of to think differently about it. And so this game that we produced called The Hand You're Dealt is one way that we're trying to do that. And we've got a grant that it's going to be available in all public libraries across Nova Scotia. Through that. There's a chapter that came out as part of this book that I did a couple of years ago that talks about where we've been able to, through using participatory collaborative approaches, where we've been able to have some impact in helping to shift that conversation, helping to create change around the organizational forces that are working to support or not, and the economic forces and where we haven't been able to have impact. And so I think that, this conversation that we're having today is sort of the beginning of, getting at it in a more meaningful way that the economic forces at play, although obviously lots of challenges. And then just to leave you with sort of the call to action, in terms of people that are here, and maybe you're not sure, okay, what part can I play in this? So just to challenge your own assumptions, or maybe talk to others and support them to challenge their assumptions. Talk to understand and hear what the other person is bringing, what concerns they have, and then act. And there's different ways you can act. And then I've highlighted there is advocating for policies and supporting advocacy, but really kind of figuring out a way that's meaningful for you to get involved. And then I'll just, this is my final slide, is I looked at sort of, Rob, I think a while ago, had sent out to his network some examples of basic income success stories around the globe in the developing world as well as in Canada. And these were some that gave some impacts on food security. So just to look specifically at how guaranteed annual income, basic income can have an impact on changing the picture around food insecurity. There's some really positive things that can happen there. So I know that Food Secure Canada is advocating for basic annual income. Valerie Trassick is a real advocate with the Proof Group, and so there's many people across the country in my field, nutrition, and in sort of food systems work that can be real allies in terms of building the case and advocating for change. So I'll leave it there and leave my contact information in case you have other questions. Thank you.
I really appreciate your talk, and I think we're at a point where if you could hold.
Report available in hard copy, real paper, with people
that can't access off the internet. Okay, what Amy is asking is, Patty, I'm not sure where you are. Oh, if there's a report in hard copy somewhere.
Yeah, we have several reports, so email me and no, this whole email thing.
Okay.
No, the people that are members of the organization that I support, you say they don't care about us because they're Boston's thing somewhere up there.
So yeah, if you leave me a phone message or give me a call, yeah, I can mail a report out to you if that's, we can chat and see which report you're looking for. But we have reports that we produce when we do food costing that I showed you there, but then we have another one called Making Food Matter that's a comprehensive